Okay, so we are going to discuss another diabetes mellitus station. It's a short station, and 65-year-old with type 2 diabetes mellitus on oral medication presented with perianal abscess and went for incision training. So, what are the types of diabetes mellitus and describe the pathogenesis of each? Basically, there are two main types of diabetes: type 1 diabetes and type 2. And type 1 is insulin deficiency. Basically, there is no production of insulin from the islets of Langerhans beta cells. This is usually congenital or genetic and present early in age, like in children or in the teens, and it is rare, about 10%, also called type 1 diabetes mellitus or insulin dependent diabetes mellitus. And this, the patient has to take regular insulin injections. On the other hand, type 2 diabetes mellitus is caused by a combination of peripheral resistance to insulin action and inadequate compensatory response of insulin secretion by pancreatic beta cells. Means there are two problems. It is usually occurs in the later on in the older populations, mostly, and like 60s, 50s, and the problem is that the beta cells, they do not respond to compensatory or do not respond to stimulation much, plus the peripheral resistance in the body, they do not the insulin receptors do not respond to insulin action. Either there is enough insulin, but the body receptors do not respond to insulin. So this is a bit mild kind of diabetes, and can be helped out by drugs initially and lifestyle modifications. Later on, maybe insulin requirement. So what is the function of okay, so this is most common. This is most common. About 90% of the diabetes is type 2 diabetes mellitus. So what is the function of insulin, and what are the hormones affecting blood glucose level? So the principal metabolic function of insulin is to increase the rate of glucose transport into certain cells of the body. So carbohydrates increases. Okay, the principal function of insulin is to push the insulin from the blood into the cells. And they have asked that what other hormones affecting blood glucose. So what is the function or action of or effect of insulin on carbohydrates? Increases the uptake of glucose into various tissues, stimulate glycogenesis in many tissues, but especially in the liver. Sorry, stimulate hepatic generation of glucose 6-phosphate from glucose. So what they do, that they produce glucose, increase the level of okay, so they increases the uptake of glucose by various tissues, and they also stimulate the glycogen formation in many tissues, especially in the liver, and they convert glucose into glucose 6-phosphatase or glucose 6-phosphate. Sorry, not phosphate, glucose 6-phosphate from glucose. Enhance uptake of amino acids into peripheral tissues, stimulate protein synthesis. For this reason, insulin can be regarded as growth hormone. Fats stimulates lipid uptake into cells, enhances oxidation of lipids once inside cells, and also causes fat deposition by stimulating lipogenesis in the adipocytes and in the liver. So what are the hormones affecting blood glucose? So all of them increase the blood glucose. These are glucagon, catecholamines, epinephrine, norepinephrine. Glucocorticoid is most important, being cortisol. and somatotropin in pituitary hormone, they all increases blood glucose level. For example, they mobilize the reserves into the serum. So this is the pictorial presentation of the insulin functions. So we have insulin from pancreas. So it acts on adipose tissues. It increases glucose metabolism, increases lipogenesis, decreases lipolysis or mobilization of the fats. It increases in inflammations, or the insulin is increased in inflammatory conditions. So increase M2 and M1 macrophage switch, convert M2 to M1 macrophage, and peripheral muscle increase glucose metabolism, increase glycogen synthesis in the muscle, increase muscle mass, increase mitochondria dysfunction, increase hunger, decrease glucose production, hepatic glucose production, and decrease lipoprotein production. Decrease glucose synthesis, increase glycogen synthesis, increase lipid accumulation, increase inflammation. So precaution for diabetic patients who are going for surgery, how to prevent intraoperative hypoglycemia, mention about optimization of glucose according to NICE guidelines. So a patient with diabetes must prioritize in the operating suite. This should be first on the list. Routine overnight admission is not necessary. Starvation time should be no more than 1 missed meal. Analgesia and antiemetic should be used to enable early return to diet and usual insulin regimen or regime. Insulin infusion should only be used if a patient is expected to miss more than 1 meal. 0.45 sodium chloride with 5% glucose and 0.15% or 0.3% KCl is recommended IV fluids. 0.45% of sodium chloride NaCl and with 5% dextrose or glucose solution and 0.15% or 0.3% KCl. This is the IV fluid for diabetic patients. Blood glucose should be measured early, during and 4 hourly after any surgical procedure. So early during surgery and 4 hourly after in the post-operative time. The WHO surgical safety checklist should be identify all diabetic patients. The target blood glucose should be 6 to 10 millimole per liter, acceptable range of 4 to 12. And sulfonylurea and metformin should be stopped 24 hours before surgical procedures. And diabetic patient for in surgery, good glycemic control, continue the preset your ongoing anti-diabetic drugs. If morning surgery, stop the morning dose. Poor glycemic control, variable insulin infusion, sliding scale. If the patient is on the list and he has good glycemic control, then you can continue the preset already which he's taking normally ongoing anti-diabetic drugs. If he is going to be operated in the morning, so he has to miss the morning dose. But if the patient previously has very poor glycemic control, then variable insulin infusion or sliding scale you have to take into account. You have to put him on sliding scale or you have to give him insulin. What are the advantages, investigations for this patient? So you have to do ABGs and electrolyte for potassium level. What are the post-operative complications for this patient? So immediate complication can be hyper or hypoglycemia, dehydration with electrolyte imbalance, hyperglycemia, hyperosmolar syndrome, and DKA can occur. Late infection, sepsis, wound infection, most commonly in these patients, they can be lead good to sepsis, impaired wound healing. Post-operatively, who you will involve in care of this patient? So endocrinologist and patient family in GP. Good counseling. What do you think this patient might need if his diabetes mellitus not well controlled on oral medication? So conversion to insulin therapy.